Hi, welcome to the Radiology Everywhere YouTube channel. In this video, we briefly discuss the radiological features of superior labral anterior posterior tears. Superior labral anterior posterior SLAP tears are injuries of the glenoid labrum. It usually involves the antero-superior glenoid labrum with a long head of bicep tendon attachment. Commonly among overhead throwing athletes due to forced extension injuries, rapid arm abduction during a fall, and the deceleration phase of throwing. There are four main types. Type 1. Degenerative fraying or a tear of the superior labrum. Type 2. Labral bicipital complex detachment from the superior glenoid. Type 3. A bucket-handled tear of the superior labrum. Type 4. Type 3 plus extension into the biceps tendon. Mr. Arthrogram is the investigation of choice. High signals in T2 and contrast on T1 images. If you like the video, share it with your friends. Subscribe to the Radiology Everywhere YouTube channel. See you soon. Bye bye.